Hi everyone, Dr. Remy from Pain Free and Fit and Posturesize. Today we're going to be going over some advanced concepts in neck strengthening exercise rehabilitation, which is a topic that unfortunately a lot of doctors, therapists, and trainers have difficulty in implementing with their clients. So whether you're one of those professionals or one of our certified Posturesize trainer candidates working on your exam, or just an everyday person looking to strengthen your neck against pain and injury, I hope this video helps you. So keep in mind that the whole concept of advancing training, either for yourself or for one of your clients with neck rehabilitation, is to induce a directional specific challenge to holding your unique posture, alignment, or stability issues. Now, in the first video on the basics of neck strengthening, we went over the 6 cardinal directions of strength and stability, including lateral flexion, rotation, forward translation, head retraction, cervical upper neck flexion, shoulder blade or scapula elevation and depression. If you have not yet analyzed yourself as an individual and don't know what your unique posture or mechanical issues are in your neck or shoulder blade, I invite you to go to either the Pain Free and Fit or Posturesize website. There's a free body analysis and you can learn what your unique posture issues are and mechanical issues are. If you already have that and you've been through several months of training where you've built up the repetitions at least to 100 and the isometric hold times of 3 minutes where you're resisting those cardinal ranges of motion, then you're ready for some of these more advanced concepts of training. Keep in mind that with yourself or your clients, you have to identify what the greatest tendency is of the dysfunction of the neck and shoulder region, because that's what's overloading the soft tissues, the fascial system, the muscular system, the joint complex, as well as the neurological coordination of holding the body in a certain neutral or safe, stable position for the neck. So what I mean by that specifically is if you have a client that has a tendency to tilt their head to one side, or elevate their shoulder on one side more than another, or have a downward rotated or abducted shoulder blade, then those particular people need to be challenged in more of a lateral stability with their exercises. If you have someone that has more of a torso or a cervical rotation problem where they turn their head or twist their upper torso to one side, or perhaps have a shoulder blade protraction or retraction tendency, then those clients or yourself need to focus on rotational stability. And finally, very common with mixing both of those are people with forward head posture and extension of the upper cervical spine, flexion of the lower cervical or neck where the neck bends forward, and extension of the upper. So we then want to challenge them in their ability to hold the corrections of whatever these unique translational or rotational tendencies are in their unique planes of motion. So for example, once we get some good stability with at least 100 reps in those strengthening exercises, or a 3-minute isometric hold time in the strengthening exercises of those 6 cardinal ranges of motion, we want to move on to using the upper extremity. When we have a pressing motion where we're going to be pressing with both hands overhead, or using a lat pull down machine or chin up or pull down, we're going to be stressing the fact that the neck in all of these motions has a front to back stability challenge, meaning that as you're doing a lat pull down, as you're doing the shoulder press, if you're having a high incline press, the neck is going to have a tendency to have that forward translation of the head, bringing the ear past the shoulder, which is dangerous, as well as extending the upper neck, meaning that the occiput, the back of the skull, travels down and compresses the top of the neck. So in all of these motions, whether we're overhead pressing or pulling, we want to emphasize the face back, the chin under the jaw, so the back of the head is rotated upwards, and we want to make sure that we're avoiding the typical flexion or downwards movement of the neck. That's especially important at the bottom of a pull down where people will typically cave. That's especially important as we press overhead. The further we get up, the more that cervical spine by the occiput or the back of the skull wants to extend. So we want to start with light resistance and work up in resistance. It's always better to work with slower ranges of motion to control these motor patterns than quick motions. And as the client improves, or as you improve in holding your stability, we can then increase both resistance and speed. If we're pressing or pulling with one hand, we're going to have a tendency to challenge the lateral system. As we press and pull with one hand, we're going to have a tendency for the head to tilt in and the shoulder to raise on that side that we're either pulling down, such as a one-hand pull down, or a one-arm press. So there we want to emphasize the shoulder blade down, avoiding the shrugging. We want to emphasize any rib cage tilting, so we're keeping the ribs and the pelvis equidistant from each other, and we want to make sure that we're emphasizing the head, avoiding the tendency to laterally flex. So if you had a client or yourself that has a natural tendency to right lateral flex or bend their right ear towards the shoulder, we want to emphasize that tilting away as we're pressing or pulling on that side, because that's going to be a greater side of challenge for them to do that. So we want to emphasize that side of pressing and pulling, a lot of shoulder blade down, ear flexion away, or head flexion away to the other side. We also want to watch out for forward translation of the head. This is common in almost any movement you can think of, but especially if we're going to use a pressing movement as opposed to a bench press where we're stable, a push-up or a dip, for instance, the lower we come down in a push-up, the more we're going to translate our head forward. So once you've built up that basic neck stability and you have a person that has a tendency to have a forward translation with their cervical spine or head where the ear is in front of the shoulder, working in the bottom portion of a push-up or the bottom portion of a dip is really going to challenge that ability to stay stable. And that includes rounding the shoulder blades as well as keeping the head back, making sure we don't extend the top of the head or flex the bottom of the neck. If we're going to be doing abdominal work, any kind of pulling activity, we want to make sure that we're including this neck correction. For instance, a lot of people will do an exercise such as a chop, where we're going to come down using the full body in terms of flexion. We're going to be using everything from hip flexors to shin muscles, anterior tibs, to abs, to chest, upper extremity. But as we flex forward, whether we're doing a leg raise, for instance, or an abdominal crunch, or curl up, or even a chop, this is something where that head is going to be challenged not to goose forward and have that anterior translation. If I do a straight chop down to the side, I want to make sure I have that neck stability. The typical tendency of a person with forward head posture is as they're stressing this flexion fascial system of integrated muscles, they're going to want to go to their strength, which is moving their head forward as resistance increases. So we want to make sure we start with a light enough resistance where we're emphasizing both shoulder blade and head correction and maintaining that as we come through for our diagonal, in this case, chop. The further we go down, the more that head is going to want to goose forward. So that's more resistance in terms of correction as we come down, allowing the pubic bone and lower ribs to come together, allowing proper hip mechanics for the greater trochanters to help that femoral head slide back in the hip sockets as we flex and come down, avoiding that tendency. If we're doing more of a diagonally oriented chop where we're coming across and really emphasizing the rotation, for those clients or people with rotational problems of either the neck or the torso, that then we want to use for people that have that rotational problem. So again, you have to decide what side they usually rotate to, what side will they usually rotate to in the exercise. You want to match the exercise to that unique individual stability pattern in that plane of motion. If we have someone with a lateral stability issue, we also could challenge them with one-arm shrugs. When you have a two-arm shrug, such as using a barbell, we're going to have pretty much equal tension from right to left sides in the neck. The neck's going to be a lot easier to stabilize. When we have a one-arm shrug, we're going to have more of a tendency to laterally flex or tilt the ear in. So again, if the client is predisposed to lateral instability, we want to choose a one-armed exercise that challenges their ability to keep the cervical spine in neutral and not go into their typical direction of distortion. If we have someone who has a tendency in their neck to have upper cervical extension, another big problem we have is with any kind of abdominal or face-up training. So, for instance, if we do a typical curl-up or crunch, where we're emphasizing pubic bone and rib flexion, the client typically is going to lead with the head with upper cervical extension and lower cervical flexion. Okay? As they do that, they're going to lead with their head as opposed to their rib cage. So the thing to go over now is to integrate, as with all of these exercises in advanced neck conditioning, we want to integrate neck and head stability as we then flex the abdominal muscles. So if you notice, I'm not leading with my head. My first thought is stabilizing the client with the neck and head. And then as you maintain that stability, we're going to lead with the bottom of the rib cage and the pubic bone activating the abdominals. Now the same will be true if we're doing diagonal curl-ups, crunches, full sit-ups, leg raises, the same thing. In leg raises, remember, as the leg is raised up, there's a tendency, if you don't have lower back stability, to overarch the lower back, increase the lordosis, anterior tilt the pelvis, and where the lumbar spine goes, the cervical spine follows. So if you're coming up with a leg and you don't have that tail under low back stability so the back stays flat, you can have a lot more of a tendency to not only arch the low back, but at the same time arch the neck and cause that upper cervical extension. So we want to make sure that we're stable both at the head and the neck for any kind of leg raises. If we're doing Pilates hundreds, if we're doing leg circles, all of that entails leg flexion or hip flexion in a recumbent position. Very important to stabilize the low back as well as stabilizing the neck and shoulder blade complex so your shoulder blades don't round, so they don't elevate, and we don't increase that cervical lordosis. Finally, we want to make sure that we're including some type of balance challenge besides resistance challenge for our clients with neck stability issues. If we have a client that has a forward to backward stability issue, such as forward head posture, we'll want to use a wobble board or some type of stability training instrument where they are challenged in a front to back motion. So standing on this wobble board that tilts me back and forth is going to induce that forward head posture. This is the direction of stability. We want to train someone to hold their neck posture as we're training both in terms of static stability, you can do that tapping on and off, and eventually with the eyes closed, as well as dynamic stability where we're balancing on that as the trainer then is trying to tap the head slightly forward to induce more anterior translation. So you begin with a static stability and you add dynamic where you're either trying to push the head forward or push the hips forward, because many times the hips and the head will go in the same direction. Clients with sway back posture where their pelvis is more anterior translated will also have a tendency to have this. So this is a great forward backward balance to both incorporate the fascial systems between the pelvis, the scapular area, and the cervical spine all in one. If we have a lateral flexion stability problem where we have a shoulder blade that comes up or head that likes to tilt, we're going to be working on our wobble board apparatus more in a side-to-side motion. Again, you have to look for the integrated nature of neck, shoulder, pelvis, and hip and leg problems. Many times with a person that has a lateral stability problem with their neck, they also have an integrated problem with hip hiking on one side, with external rotation of the femur, where they walk with one leg slightly out, with an overactive ITB or tensor fascial lata system, lateral peroneal system, and a pronation problem with their foot, because that all integrates into what can I do from side to side. If my hip is used to hiking, I'm going to have a compensatory rib lean to that side, and then a compensatory cervical lateral flexion to balance me out. So I want to integrate these things as I hold on at the beginning for a little stability, that I'm correcting both hip, low back, neck, and shoulder blade issues, and eventually I'll not hold on and balance, and eventually eyes closed balance. If we have a rotational problem, then we want to use a wobble board or a foam pad where we're on one leg, because when we stand on one leg, we have a lot more of a tendency for the pelvis to rotate away from that leg, especially if we have an externally rotated hip on that side. So we want to train our clients or ourselves to keep the pelvis straight, rotating the pubic bone in towards the standing leg, maintaining balance at all 4 points of the foot, and then correcting any torso or neck rotation. So this will be challenging just to stand on one leg. After a while, if you close your eyes, that makes it more difficult. And as I said before, if you have a trainer tapping the body trying to induce rotation at either the pelvis, the torso, or the neck, that's going to give a greater challenge. So putting all these principles together, we're trying to use both resistance, we're trying to use speed, and we're trying to use balance to induce the typical tendency of instability in that unique plane of motion. So identify either in yourself or your clients which way your neck stability tendency is, whether it's more of a lateral flexion, a rotation, a front or back, sagittal type instability, and then appropriately use the exercises or direction of exercises to challenge that. That indeed will help you stabilize your neck under more dynamic conditions and make it a much more functional exercise that's going to meet your needs during the day to help keep your neck pain-free and fit. Hope you enjoyed. If you like this video, give me a thumbs up below. Let's share it with some other people. If you have any questions or comments, please leave them below. I'll do my best to answer. Remember that we always want to be strengthening proper function and not dysfunction. So a little time spent in learning what your unique issues are in terms of your posture and mechanics or your clients goes a long way to really getting the best results with your rehabilitation.